Revascularization is a medical procedure that aims to unblock arteries or veins in order to restore proper blood flow. This is commonly done for individuals with peripheral artery disease, PAD, to alleviate symptoms and prevent further complications. The main objectives of revascularization are to reduce pain, maintain mobility, promote healing of wounds caused by poor blood flow, prevent limb amputation, and enhance overall quality of life. If your arteries are so blocked that blood can't reach your legs and feet, you might need revascularization. This procedure isn't for everyone, though. It depends on how severe your symptoms are. For less severe cases, like intermittent claudication, you might start with a rehab program and medication. Quitting smoking is also important. But for more severe cases, like ischemia, prompt care is needed to prevent tissue damage, ulcers, or even amputation. Revascularization can be divided into two main categories: less invasive interventional procedures and more traditional surgeries. Interventional procedures are typically done while the patient is still awake, but with medicine to keep them comfortable. There are two main types. Angioplasty: a small balloon is used to open a blocked blood vessel. This is done by making a small cut in the groin and inserting a catheter into an artery in the leg. The doctor then places a small balloon into the narrowed blood vessel and expands it. Some people may also get a stent during angioplasty to help keep the blood vessel open. Atherectomy: a catheter with a sharp tool attached is used to physically clear out the plaque causing the blockage in hard-to-reach areas. For those who need revascularization surgery, it is typically done under general anesthesia. There are two main types. Bypass surgery: a vascular surgeon uses a graft of a blood vessel to reroute blood flow around a blockage. Endarterectomy: a surgeon opens the artery to remove plaque buildup inside. In some cases, a hybrid procedure that combines both a catheter-based intervention and open surgery may be used. Complications can occur with revascularization, especially if you have other health conditions like coronary artery disease, chronic kidney disease, or diabetes. Some potential complications include restenosis, calcification, microvascular disease, and silent embolization. Interventional treatments may lead to problems such as bleeding at the catheter insertion site, or rare cases of blood clotting or excessive blood flow to the limb after the procedure. Complications after bypass surgery or endarterectomy are rare, but can include injury to the blood vessel, mild leg swelling, wound site issues, or reblockage of the artery. Your doctor will closely monitor your recovery after the procedure to ensure everything heals well and remains successful. After surgery, most people stay in the hospital for a few nights, possibly up to a week. You might feel a bit tired for a few weeks and have some mild pain around the incision and some swelling in your leg. As time goes on, you should be able to get back to your normal activities, but make sure to follow your doctor's instructions for recovery. If you have an interventional procedure, the recovery time is likely to be shorter. You may be able to go home the same day as the angioplasty or stent placement. At first, you might notice some swelling in your legs or feel a bit sore in the groin where the catheter was inserted. Soon, you may find that you can walk further than before the procedure. After an atherectomy, you may be back to your normal activities within a week. Again, make sure to ask your doctor for instructions. If you've had a stent placed, you may need to take medications to prevent clotting around the device. So, what can you do to make your PAD symptoms less severe? Are there other treatment options you should try before revascularization? What will likely happen if you don't have revascularization? How do you know when it's time for this procedure? What are the risks? And afterward, how can you help keep your PAD under control? What sort of follow-up visits will you need and when? And how likely is it that you'll need to have another revascularization again in the future?